Hello, my name is Dr. Dewan S. Raja. Today I will discuss about psoriasis. Psoriasis is a chronic autoimmune skin condition that causes the rapid buildup of skin cells, leading to scaling, inflammation, and redness. Skin cells means the epithelial cells. Keratin, epithelium. We have multiple layers of the epidermis. All of them will proliferate and there will be buildup of the epithelial cells. It occurs when the immune system mistakenly attacks healthy skin cells, accelerating their growth cycle. The most common type is plaque psoriasis, which appears as red, scaly patches, often on the elbow, knees, scalp, and lower back. Approximately 15% patients with psoriasis have associated arthritis that can affect any joint of the body, may be symmetric or asymmetric. In addition, psoriasis may be associated with myopathy, enteropathy, like Crohn's disease, ulcerative colitis, and acquired immune deficiency syndrome. So these are the associated conditions that may arise along with psoriasis. Okay, so this is the pathogenesis. Psoriasis arises from genetic and environmental factors, with immune cells infiltrating the skin and triggering cytokine drive and keratinocyte proliferation. Key cytokines like IL-12, interferon gamma, TNF, and IL-17 fuel inflammation, and TNF inhibitor shows therapeutic success. Lymphocyte growth factor contribute to epidermal thickening, while local trauma can induce lesions known as Cobbler's phenomenon. This is important. Cobbler's phenomenon. Okay, local trauma can induce it. Okay, so we got the pathogenesis. We'll also have bleeding points in the lesion. We call it auspice sign. Okay, so this is from Robin Scott and Kumar's pathologic disease. If we go through these images, early lesion may be dominated by inflammation marked by the presence of small pustule and erythema. Pustule and erythema. Okay. Established chronic lesions are erythematous and covered by characteristic silver-white scale like this. Microscopically, there is epidermal hyperplasia, hyperkeratotic scale, and accumulation of neutrophils within the superficial epidermis. Okay, so these are the histology here. We'll get neutrophil here. Okay, now let's go to the third slide, fourth slide. Okay, we have to go to the fourth slide now. Lesions well demarcated, pink salmon colored plaque with silver white scale. This is a key feature. Histology, epidermal thickening, acanthosis, elongated rete ridges, and thinning of epidermis over dermal papilla. Auspice sign, pinpoint bleeding when scales are removed. Nail involvement, 30% of cases, pitting, discoloration, thickening, and onycholysis. What is Kovner's phenomenon? Lesion triggered by skin trauma. Variant, pustular, erythrodermic, gutted type. Okay, so we find the auspicious sign here, and we also get the other features of psoriasis, like Kovner's phenomenon, that is a lesion triggered by skin trauma, auspicious sign pinpoint bleeding when scales are removed. These are two important points you have to remember. Okay, this is a plaque psoriasis, and this is called gutted psoriasis, different type of psoriasis due to usually young age group up to 30, and also maybe adolescent, infant, boys, girl may have this problem. These are usually small, they come without any warning, and this diameter is around 10 millimeter. Okay, less than this. Okay, so what is the treatment? Topical treatment, mild to moderate cases, corticosteroid reduce inflammation and scaling. Vitamin D analogs slow skin cell growth. Coal tar and anthralin reduce inflammation and scaling. Phototherapy, moderate to resistant cases. Systemic medication, methotrexate, cyclosporin, ectritin. Biologic therapeutic agents, TNF inhibitor like risankizumab. This is the treatment plan for the psoriasis. Okay, we got the treatment. Now we go to the last page, and this information and images in this presentation have been taken from multiple resources for teaching purpose only. Okay, now that's all about my YouTube video on psoriasis, a very common skin disease, and some associated diseases like that of HIV infection, maybe joint pain, cardiovascular problem, liver problem, okay, that may be associated with that of this condition, the psoriasis. Arthritis is very common. It may be associated with hypertension, heart problem, liver and kidney problem that may be also associated. There may be maldigestion, enteropathy, heart failure may be an accompaniment of the psoriasis. Okay, so thank you very much. Again, please subscribe me. Have a nice day. Bye now.